So today we are going to deal with physical examination. It is a revision class for you people. It is the systemic collection of objective information that is directly observed or is elicited through examination techniques. Okay. So we are going to examine by observing the client. There are some techniques of physical examination. 4 basic techniques for physical examination are inspection, palpation, percussion, and auscultation. Last one is manipulation. We used to manipulate the body parts and get some reflexes from the patient to know the physical condition of the patient. First is inspection. It is the systemic visual examination of the client, or it is the process of performing deliberate purposeful observation in a systemic manner. It involves observation of the color, shape, size, symmetry, position, and movement. It also uses the sense of smell to detect odor and the sense of hearing to detect the sounds. Mainly in inspection, we are going to just observe the patient and assess for the externally. General inspection. Overall appearance of health or illness, we will see sign of distress, and then we will check facial expression and mood of the patient, then body size of the patient, grooming and personal hygiene of the patient. Second one is palpation. It is used of the hands and fingers to gather the information. Through touch, it is the assessment technique which uses senses of touch. It is feeling the body or a part with hands to note the size and position of the organs. We will palpate the organs to assess the site of the organ or condition of the organ. The hands and fingers are sensitive tools. As we all know, we can assess temperature, turgor, texture, moisture, vibrations, size, position, any kind of mass or fluid presence in the organs. Then dorsum back surface of your hand and fingers are used to measure temperature. We almost check our temperature by this method. Then palmar, that is front surface of your finger, and finger pads are used to assess texture, shape, fluid size, consistency, and pulsation. Vibration is palpated best with the palm of the hand. Okay, when you are going to give vibration or check vibration, you use your palm part of your hand. This is palpation. A person is using their hand to palpate the organ. Third is percussion. It is the examination by tapping the fingers on the body to determine the condition of the internal organs by the sounds that are produced. Percussion is the act of striking an object against another to produce the sound. By the striking action, over body tissues are known as percussion tones or percussion notes. And it is also used to determine the structure is air filled, fluid filled, or solid. How we will measure the degree to which sound propagates, we will call resonance. The SI unit by which sound propagates, that is resonance. Percussion produces characteristic tones, that is tympanic, hyperresonant, resonant, and dull and flat sound. Hyperinflated lung tissue sound is hyperresonant sound. In normal lung tissues, there is resonant sound. For liver, dull sound is normal, and for bone, flat sound is normal. This is a method of percussion by striking your finger over your finger. and tap that organ. Fourth one is auscultation. It is the process of listening to the sounds that are generated within the body. Auscultation is usually done with a stethoscope. The heart and blood vessels are auscultated for circulation of blood. Lungs are auscultated for moving air, that is breath sound. The abdomen is auscultated for movement of GI contents like bowel sounds. There are 4 characteristics of sounds are assessed by auscultation. That is, you will have to assess the pitch ranging from high to low, loudness ranging from soft to loud, then quality, that is gurgling or swishing, duration, short, medium or long. This is the way of auscultation by stethoscope. Last one is manipulation. It is the moving of a part of the body to note the flexibility, limitation of movement, and it is discovered by this movement by testing of reflexes. The response of the tissue to external stimuli is tested by the means of percussion hammer, safety pin, wisp of cotton, or hot and cold water. We can use these things on different parts of the body to check the reflexes. And this is a percussion hammer by which you are checking tendon reflexes. Then we are going to general examination, that is head to toe examination. First of all, role of nurse in general examination. First, preparation of environment. Environment should be calm and quiet. Maintaining privacy. A separate examination room is needed because you are going to expose certain parts of the patient's body. So there is need of separate room. Keep the door closed. Relatives are not allowed in that room. Lighting should be proper. There should be adequate lighting or natural lighting. Comfortable bed or examination table. Client should be placed comfortably throughout the examination. Then preparation of equipment. All equipment should be there at that time. Preparation of the client. Physical preparation and mental preparation. Physically, you will ask the patient to do whatever cleaning or passing urine or passing stool. Then mental preparation. Tell about the procedure, what are you going to do on your patient so that he can comfortably participate in that. These are the articles we will going to use in physical examination. Sphygmomanometer, stethoscope, fetoscope, TPR tray, tongue depressor, pharyngeal retractor, laryngoscope, tape measure, flashlight, weighing machine, ophthalmoscope, otoscope, tuning fork. These are the purposes to use these articles. Then nasal speculum, percussion hammer, vaginal speculum, proctoscope, gloves, sterile specimen, bottles. These are the picture of some articles. Then general examination. It is examination carried out in orderly manner, focusing upon the area of the body at a time. We will take order wise. General appearance. In general appearance, you will check the nourishment. Patient is well nourished or undernourished or malnourished, you can say. Body build, thin or obese. Health, patient is healthy or not. Activity is dull, patient is tired or lethargic. You have to check all these. Then mental status. In mental status, you will check consciousness, unconsciousness, delirious, talking incoherently, then look anxious or worried looking patient or depressed looking patient. You can see the obese patient, thin patient, malnourished or undernourished or well-nourished patient. Then mood in this picture all things are shown. Then you are going to check posture of the patient body curves, that is lordosis, kyphosis, scoliosis. Lordosis is inward curve of the spine. Then kyphosis is spine move forward. Then scoliosis, it is a sideways curvature of the spine. Then you will check height and weight of the patient. Skin condition. In skin condition, you will check color, that is pallor, jaundice, cyanosis, flushing, etc. Any kind of discoloration. Texture, you will check for dryness, flaking, wrinkles or excessive moisture. Then temperature, patient is feeling warm, cold or clammy. Lesions, any kind of macules, papules, vesicles, wound, etc. These are the skin condition, and this is kyphosis, normal and lordosis. You can see their pallor skin or patchy skin discoloration. Then head and face. Shape of the skull and fontanelles. Usually we see these things in newborn. Skull circumference, scalps, cleanliness, condition of hair, dandruff, pediculi or any kind of infection you can see. Then you look for face, pale or flushed skin, puffiness is present or not, fatigue, pain, fear, any kind of anxiety, enlargement of parotid glands, etc. You will see over the face. Then eyes. In eyes, mainly you're going to examine. The examiner frequently uses a torch or head mirror or reflect light to the client's face. The first examination is one of the inspection to determine the movements of the eyes, reaction of the light, accommodation to near and far objects. In this we will check eyebrows. Eyebrows are fully distributed or not, that is normal or absent. Eyelashes, is there any kind of infection or sty present. Eyelids, edema, lesions or ectropion or entropion present. Eyeball, sunken or protruded. Conjunctiva, pale, red or purulent. Then sclera for jaundice. It can be checked for anemia also. Cornea and iris, irregularities or any kind of aberrations. Pupils dilated, constricted, reacted to light by using a torch. Then lens, opaque or transparent. You can see here different type of abnormalities. Opaque lens, yellowish sclera or purulent formation, styles. Then you will go for fundus, congestion or any hemorrhagic spot is there or not. Eye muscles, you will check eye muscles by checking eyeballs, that is strabismus, squint eye is there or not. Vision, normal, myopia or hyperopia by using Snellen's chart. Ears, in ears you can assess by speculum of various sizes or cotton tipped applicators can be used, and otoscope can be used in this. And you will use tuning fork to assess the ears. External ear For external ear, you will check discharges, cerumen obstructing the ear passage. Tympanic membrane, is there any kind of perforation, lesions or bulgingness is present or not. Then you will check for hearing acuity, patient is able to listen normally or not, by using tuning fork. There are two types of tests, Rinne's test and Weber's test. Rinne's test compares the sound transmitted by air conduction to those transmitted by bone conduction through the mastoid. Air conduction should be greater than bone conduction. Then in Weber's test with tuning fork, in this we will strike the tuning fork and place it over the head, in the midline of the head, and the sound heard by the patient is equally distributed bilaterally. So these two tests are conducted for hearing acuity. Then nose. External layers, you will check crust or any kind of discharge is present or not. Nostrils in nostrils you will check inflammation of the mucous membrane or any kind of septal deviation by using your fingertip. Mouth and pharynx, you will check first lips, redness is there or not, swelling, crust or cyanosis, stomatitis or any kind of odor from the mouth or foul smelling. Then teeth for discoloration and dental caries. Mucous membrane, you will check for ulceration, bleeding, swelling. Tongue, pale dryness or lesions, etc. Throat and pharynx for enlarged tonsils or redness. Then neck need to be palpated for lymph nodes in order to assess the thyroid gland, or client is asked to swallow saliva so that we can assess thyroid gland. In this you will check lymph nodes, enlarged palpable thyroid gland, enlarged range of motion, flexion and extension or rotation. In chest you will check for thorax, shape, symmetry of expansion, posture. Then breath sound. For breath sound you will check wheezing sound is there or not, crepitations, that is crackling sound, pleural, rub, etc. Heart, in chest heart you will check for size and location of the heart, cardiac murmur or any kind of sound abnormality is there or not. Then in breast you will check for enlarged lymph nodes. Then in abdomen, it is examined while the client is in dorsal recumbent position and the knees are slightly flexed. Promote relaxation of the abdominal muscles. Abdomen is inspected, palpated, auscultated and percussed. There is some deviation in the series. Usually we inspect, palpate, percuss, then auscultate. But in abdomen we inspect, palpate, auscultate, then percuss, because it can stimulate the abdomen sounds. First of all, you will observe for skin rashes, is there or not, hernia. Hernia is because of weak muscles of any organ, there is some protrusion. Some part of that organ is protrude out, that is hernia. Ascites, distension, pregnancy, etc. Auscultate, we will auscultate bowel sounds, or if the patient is pregnant, then we will check for FHS also. Then palpation, margin, palpable spleen, tenderness at the abdomen, all these we are going to check. Then percussion, presence of any kind of gas, fluid or muscles. Then we will go for extremities. Movement of the joints, tremor, clubbing fingers, varicose vein, reflexes, etc. These are varicose vein and clubbing fingers. Then back. Ask the patient to in a standing position. Spine is examined for abnormal curvature. The fingers are moved over the spine to detect the spina bifida or any newborn infant having any kind of defect. So we can use this method by palpation. Then genitals and rectum. Inguinal lymph nodes enlarged, palpable. Patency of urinary meatus and rectum, descent of the testes, vaginal discharges, presence of STD, sexual transmitted disease, hemorrhoids, enlargement of prostate gland. All these we are going to check in genitals and rectum area. This is enlarged prostate, and this is types of spina bifida. Next we are going to come on neurological tests. In neurological tests there is coordination, equilibrium, reflexes test. Neurological test includes examination of the reflexes, coordination, equilibrium, sensations of touch, pain, vibrations, position, temperature, discrimination, tonicity, movement of the muscle. There are some reflexes. A reflex is an automatic response of the body to the stimulus. Reflexes are tested by using a percussion hammer and a pin or a cotton wool. First of all, biceps reflex. This is tested with the doctor's thumb on the bicep tendon or examiner thumbs on the biceps tendon and gently tapping with a percussion hammer. The contraction of the muscle is noted. Then we will check for triceps reflex. The client's arm is supported in a relaxed position and is tapped with a hammer just above acromion process. Normally the forearm will be straightened. Then patellar reflex. And this client is seated at the edge of the examination table with the legs dangle and tap the area just below the patella. Normally the lower leg will kick forward. Then Achilles reflex. In this, ask the patient to be in a same position. Foot is supported with one hand and Achilles tendon is tapped. The normally response is downward jerk of the foot. Then plantar reflex, and this plantar reflex we call differently in babies, that is Babinski reflex. The sole of the foot is stroked with a sharp instrument such as pin. Normally all toes bend downward, that is negative Babinski. In abnormal response, the toes spread outward and big toe move upward. Then we will go for coordination test. It includes finger to nose test, heel to shin test. In this, client is asked to abduct and extends the arm at shoulder height and repeatedly touch the nose alternately with one index finger. Then with other. In abnormal response, the client will miss the nose. These were the tests we do in neurological assessment. So thank you for the class.